Good day everyone, my name is Elizabeth Ozamora, a second-year nursing student of NR23, and now I will demonstrate on how to measure anthropometric measurements of a newborn baby or child's physical development. And we need this following: baby weighing scale and tape measure. And also, we use infantometer for measuring the height of the baby. In measuring anthropometric measurements, we need to measure first the head circumference of the baby, second, the abdominal circumference, third, the chest circumference, fourth, the weight of the baby, and last, the height of the baby. And today, I have here a female newborn baby named Irfi. She is 2 weeks old, and now I will measure her head circumference. And first, we will measure the head circumference of the baby. And first, we need to remove the bonnet or the cup of the baby. And we will use a tape measure in centimeter. So we will do this one and this one. So the head circumference of this baby is 33 centimeters. And next, we will measure the chest circumference of the baby. We will also use a tape measure and the centimeter. This is the procedure. Okay, we need to measure this chest circumference of the baby in the level of the nipple. So the chest circumference of the baby is 32 centimeters. And we will also measure the abdominal circumference of the baby. We need to measure the abdominal circumference above the level of umbilicus. We will also use a tape measure. So, the abdominal circumference of the baby is 32.5 centimeters. Mostly, the abdominal circumference and chest circumference is nearly the same. And now, we will measure the height or length of the baby. First, we will position the baby. And then we will also use tape measure, but in some hospital, they are using the infantometer. It is designed for the infants. So, it has a base here and another base here, so the baby will be fixed on the measurements. But this time, we will just use tape measure. And make sure the baby is straight. Let's make the baby straight. And also her hands. And the baby must be stable and calm and not crying also. So we will use the tape measure, also in centimeter, on the top of the head of the baby and also in the bottom of, up until the bottom of the feet. So the height or length of the baby here is 48 centimeters. Lastly, we will measure the weight of the baby. So we will use a baby weighing scale. We need to cover it with a blanket. And the baby must be naked. So we will remove all the clothes of the baby. So we will have the accurate measurements. So the baby is now naked. We must sure that the baby is stable and calm and not crying. baby weighing scale is digital. You must sure when you start the bottom of the weighing scale, it must be 0, 0, 0 on the digital. And then start it on weighing the baby. So we will just pretend that the weight of the baby is 3 kilograms. And now I will tell you the normal range of the measurement of the anthropometric measurements of the newborn baby. First, the head circumference. We have 32.3 cm to 36.4 cm. And for the chest and abdominal circumference, we have 13.5 cm to 33 cm. And for the length or height of the baby, it must be 45.1 cm to 51.7 cm. And for the weight of the baby, it must be 2.1 kilograms to 5.2 kilograms. And now we will write all the data of the anthropometric measurements of this baby. First, the name. The name is Irafate Zay Velasco, and the age is 2 weeks old. And we will write here the measurement results that we had earlier. So for the head circumference, we have 33 centimeter. It is on the normal range. And for the weight, we have 3 kilograms. And for the height, we have 48 centimeter. And for the chest circumference of the baby, we have 32 centimeter. And for the abdominal circumference, we have 32.5 centimeter. But in some references, the abdominal circumference of the baby is not really recommended, but we still get the data of it. So for the interpretation of the received data, the head circumference of the baby, the weight, the height, the chest circumference, and the abdominal circumference must be on the normal range. So the head circumference of the baby must be on the 50th to 90th centile of the chart. I will show you the chart on screen. And also, the length or height of the baby must be 10th to 50th centile on the chart. And also, the weight of the baby must be 10th to 50th, located on the 10th to 50th centile of the chart. So the interpretation of the received data of the baby is all average physical development. This is according to the chart. And now we will discuss about motor reflex or startle reflex. It is an infantile reflex that develops between 28 to 32 weeks of gestation, and this appears 3 to 6 months of age of a newborn baby. It is a response to a sudden loss of support, and it involves 3 distinct components, which is spreading of arms, pulling of arms, and crying. I hope you have learned something from my video. Thank you for watching. Bye!